But healthy community, I think, is one that potentially can grow its own food and be self-sufficient, self-reliant, no? Knowing where its food comes from. My mother used to say, somos pobres and we have cartones in our shoes, right? We have, cardboard in our shoes. He says, but we have good food to eat because we grow it with our own hands.
A place where people could communicate with each other, and you won't be scared to go outside and be yourself around those people that are outside. You could just simply go around, be safe.
Healthy communities consist of healthy people, healthy land, healthy animals, healthy air, just everything that supports health in all its forms. And that's sustainability. But you have to have a strong foundation, and to create the conditions for health is the best way to ensure that you have ongoing sustainable community and its continuation into the future.
Well, I think there's folks who have done research on looking at the relationship between design and healthy communities. For example, walkability. There is a relationship between walkability and the health of people in that area. Access to healthy foods, for example. So you also want to make sure that you have non-polluting activities. Because another way that health is affected is the extent to which people are having to breathe in chemicals, to breathe in the fumes of the pollution.
Well, health, if we really look at all the components that affect health, if we look specifically at New Mexico, one of the big social indicators or one of the big social issues affecting our communities is poverty. If we were to address poverty, then maybe the health status of the community would be different. Why? Because people would have access to transportation, because people would have health insurance. In this kind of system that we live in, you either have to have Medicaid or insurance in order to have good health coverage.
Well, in Bernalillo County, just within our one county here, the census tract with the lowest life expectancy is 66 years, and the census tract with the highest life expectancy is 94 years. So health can take away 20 years of a person's life, and part of that is neighborhood based, place based. Part of that is economic, but there's that place based to that there's these neighborhoods that just, between poverty and environmental conditions, impact people's health in a way that they die 20 years earlier, or they live with disabilities for a larger part of their life. And so it's just a standard quality of life issue, or if you want to frame it, it's a social justice issue.
There are places in the county where people have the shortest lifespan and the highest burden of chronic disease of any place else in the county, and we understand that those conditions don't have to be that way, and that we can't just use doctors and hospitals to get us out of those chronic disease problems. There are other things happening in the built and social environments that contribute to disease, and therefore local government has the capacity to apply its existing departments and its existing policy mechanisms to improve health.
Health impact assessments is looking at what is the data that we know that correlates different types of environments with different types of health outcomes, whether it's reducing pedestrian accidents or car accidents, or particulate matter, which impacts asthma, there's a lot there, and I think that may be the point where people say, well, that's outside of my scope of work, or beyond that. That's the point where you partner with public health people.
Health impact assessment, it's a way of beginning to quantify how you use policy and to quantify the actual, to imagine the changes that you can actually bring about. So, for example, if you looked at traffic fatalities as an easy example, you could basically say, if we made these improvements to this intersection, we could decrease the rate of traffic fatalities. If we made the intersection safer, people might want to get out and walk more. People might want to get out and ride their bicycles more because they don't feel afraid of getting hit by a truck when they cross the street. Okay? Or you could look at economic development policy. You could say, well, there's no good grocery store within 2 miles of where somebody lives. If that person doesn't have a car, it makes it hard for them to assemble the ingredients necessary for a healthful meal. So if you had an economic development policy that enabled local grocers to change their inventory to make it a healthier inventory instead of just like chips and beef jerky and beer, you could actually improve the conditions in the neighborhoods where people live. And it doesn't take any special new knowledge to do that. Local government already has all the power it needs and all of the policy-making capacity that it needs. It just needs to focus more specifically on health. So health impact assessment is a way to actually look at quantifying what the health problems are and looking upstream at how to change them.
The healthcare system in the United States isn't going to work without people's involvement. The medical care that you receive is such a small part of what makes you healthy that it requires changes in behavior, it requires changes in systems, it requires in the way that we move, it requires changes in the way that we eat. And these things don't happen overnight. And without understanding the linkages between our food environment, without our medical environments, the way we live, the way we eat, the way we sleep, the way we work, that we can't improve the health care of the United States or even our local communities. And so getting involved as a community asset, working with your neighbors is absolutely essential for healthy families, healthy communities, healthy states, healthy lives in general.
Bring awareness of the initiatives that are happening and see how people can become more involved, because that's bringing personal responsibility to the process. That's engaging people, that's empowering people and saying this is part of the solution. You are part of the solution. We are bringing you in because your voice is extremely important for us. More informal gatherings, look for spaces and places where people meet, so that you could really have focus group discussions. They don't necessarily have to be, this evidence-based tool. Because working, and I'm going to speak for the Hispanic Latino population, there has been an exponential growth in the last 2 decades of Hispanic Latinos, right? Therefore, there's not a lot of evidence-based research projects, tools that are out there, because this is a new trend that we're seeing in the population. So a lot of this, it's going to be emerging or promising practices that we don't know about, but we only know about them through our interaction with the community. How do we do that? By immersing ourselves with that community. And how? By really considering what cultural background they come with, what linguistic background they come with, and then us to go back with that, a person of course that has that capacity to interact with them and really engage them in the process. And one of the things that we have learned throughout the years is that if you really want sound changes with respect to policy, with respect to education, with respect to social change, you need to involve the individuals that are part of that environment from the beginning.
They should also focus on the people that talk Spanish because they're part of this community too.
Sometimes a survey could be helpful, but then again, I don't think it's the best way to collect it. I think it's better to communicate with one another and hear each other's opinion, not by just written sources.
You learn some things on your own, but you pull in other people. That's where we start to work across disciplines with each other so that we can be supportive of each other.
We need to put the power aside and really look at people as people and really engage them in this, idea that you may have and say, what do you think? How do you foresee this changing? How would it be better for you, for your kids, and for your kids' kids? So thinking into the future, it's through these relationships and really sincere, honest conversations that we could have. Because many times we gloss things or we're afraid of speaking of the truth. But if we communicate with people with the truth and really try to get frank, honest feedback about how the health of the community could improve, I think we could get a lot of great information that we could use to then come back to our partners in academia or in community-based or in the public sector and say, this is an idea that came from the community. Mm-hmm. How can we work collectively to make this happen?
A lot of public health people know that built environment impacts health, but they don't know the specifics. That's where they need planners. So we need to start learning to work as broader teams. And a health impact assessment really just takes data that we know correlates to good health in other places and makes a better educated guess as to what's going to happen here if we do these different options of built environment in this neighborhood. And I think that's important for planners to understand and take into consideration. There's a newly developed health equity impact assessment, which looks at how things impact different groups, and that's obviously more complicated, and we haven't tried to do that yet in Albuquerque, so we don't have a background, but I know that's, from looking at the literature, that's something new that's coming up that we may need to learn. All of those tools are just tools, really. And those tools are usually saying, if we do this thing, we're going to get this result. The other kind of way to do it is what's called health in all policies, which is to say, here are the things that improve health. Which of these fit well for this neighborhood? And I think kind of creating a menu ahead of time as opposed to let's create a plan and then evaluate it. And I think that's a much more proactive approach. But we might have to do a few health impact assessments to start to gather that data and gather that knowledge and make health an issue in planning as well as other groups. Open space, parks and recreation, they're resistant sometimes to creating more parks because then they have to maintain them. But if we're talking about improving people's health, that's reducing the cost of emergency room visits or something. We have to be able to kind of do that math to help people see where all of this fits together.